So let me say this, right? In my introduction, what I didn't say is that I am the caretaker for my mother, who's 79. My son, who has special needs, is 27. He and I took care of my father in my home for almost 7 years after he had a stroke and was paralyzed on his right side. So when I say I can speak from lived experiences, my son has a host of mental health needs because he had a brain surgery at 1. And then my dad lost his first child and hit his depression, and I didn't learn that until I became his caretaker and had to start putting off the pills and medication and things like that. So what I will say about what we just did at CHC is we try to present information that is evidence-based, right, and research-driven. We all can have assumptions and thoughts about what we think is going on or what we think is needed in the community, and that may not be the case, right, as Natalie and others have said before. So Alex, our resident and scholar here, did some research for us, pretty extensive research, and we determined that loneliness and isolation is now a public epidemic. I think it was the Surgeon General that said that loneliness and isolation is the equivalent of smoking 15 cigarettes per day. So I'll let you think about that for just a second, right? 15 cigarettes per day because you're isolated and or lonely. And let's just be clear, isolation and loneliness doesn't mean physical proximity to someone else. You can be in a home, you can be in this room today and still feel isolated and lonely. But because we have such a stigmatized society, people are not comfortable coming forward and talking about those types of things. They won't even want to admit that to get support. So what we did was we convened an invitation-only roundtable. And we called it the Innovation Roundtable on Fostering Connection as Medicine. So I'll let you think about that as well, right? And so what we did was we invited practitioners, healthcare providers, insurers, community leaders, citizens, anyone, right? Alex is smiling because he was helping us, he really helped put this entire thing together for us in a few weeks' time, actually. And we had thought-provoking questions that each person went around and answered with regard to this epidemic. So we are starting to address some of the more uncomfortable, not so often talked about issues at the community level. But we're not stopping there, because anybody can come and talk, we can feed you, and we do have really good food, let's feed you.
That's why Jim shows up.
That's why he shows up all the time. But we still haven't ordered his favorite chicken wings yet, but he keeps coming back. But anyway, but the point, right, is that every person who left had to make a commitment as to what they were going to do individually and what their organization is going to do going forward to help us address this issue. Backing it up, so CHC, we've been in place for 70 years. We are agnostic to geography or issue. We specialize, though, in some things: mental and behavioral health, maternity health, education and information across all spectrums. So when I say that, we literally address every barrier: food insecurity, housing, transportation, accessibility, not just physical, right? But everybody can't get onto a computer or a phone or whatever, right, for care. They may not have internet where they live or what have you. So we literally address all of those barriers at the community level. We don't go in unless we're invited, but we do go in because we're trusted. And actually some of the biggest names in the world come to us. Kenview, others come to us because we have the trust, where they've tried to swarm into the community thinking because they have a lot of money, they have a big name, that they can make an impression and do the work. It doesn't mean the community is going to accept you.
Absolutely.
It doesn't mean they're going to trust you. And it doesn't going to mean you're going to get the desired outcome that you want just because you have a lot of money or a big name. So we connect and convene people. I mentioned in my intro that we have the first ever, and we've done the research to prove this, Leadership Council for Healthier Communities. This is a membership group. It's nationwide. Some of our founding members are APAF, Milken, Ardelex, Johns Hopkins University, soon to be Amazon, and a few others, right? Melissa already left, I was going to say I know it as well. Melissa's got but the point of this, right, is not just to convene people to have conversations. We're convening and we're going to be talking about tracks, mental health, obesity, etc. but then we're going to be action behind that. We're then further going to be producing data health cards and scorecards based on community so that we can then work with the individuals, the mayor, Alan, right, whomever, to actually address the root causes. What we find with our nonprofits is they're fantastic, they're fabulous, but sometimes they can't address the root cause. They can come in, right, and provide you with a soup kitchen or food pantry. We want to figure out why you can't afford your food. Why can't you access it? And then we want to solve that problem. So that's some of the things that we're doing at CCNA. Does that help?
It's very helpful.
That means stop talking, Andrea.
No, I just want to make sure that in the room, I know Jackie and Melissa were there for the session at CHC. Any thoughts on your part about the session itself? Jackie?
I would just say that it was an incredible session in terms of the diversity of thought in the room. People that, sometimes we go to meetings, I call them the usual suspects. These were brand new people, brand new ideas, different perspectives, great thinking from an international setting, from an international perspective. It was an incredible, thought-provoking session. And, coming up with some ideas on creating safe spaces, community safe spaces, how to address stigma, women's issues, all kinds of things, including AI. We talked a lot about computers, the good, the bad, the ugly.
Melissa?
Melissa?
I agree with everything you said, and also the food was great. No, it was a wonderful group of people, very insightful, different people. I met people I had never met before, and I love that opportunity of connecting with those folks, so it was great.
Part of today's effort, though, is to make sure we continue to connect and share. I'm looking at the young man here, Alex, who goes to Florida. He's Florida. He did a wonderful job putting the panel together. Let's give him a hand.
Yes.
Oftentimes we don't acknowledge our young people. There's another thing I'm remiss too. We did a very poor job of acknowledging Dr. Vance because of what she's done over the past 3 or 4 years. When she came to us, she had 7 young black female grad students looking for a place to train. She wound up here, and I wanted to personally congratulate you and all those girls getting a PhD. Connections count. Alan went to George Mason University. He is a real pain in the ass. What he said was, Jim, you really need to meet Dr. Nullarbor at George Mason. So we did. And could you share our experience together?
Thank you for coming and seeing our program.
Thank you for the tacos.
Yes. We had a lunch after the tour, but I got to stay at the same place for lunch number 2 for my staff retreat. So, and by the way, I found out afterwards that Colonel Page had introduced himself to the staff. And again, when I say staff, I'm talking about 1 full-time office manager and 3 part-time advanced undergrads who each work 10 to 20 hours a week. So that was my staff, but they were quite impressed. So our center, as I mentioned, we are training and we are providing community service in terms of not only therapy and testing, but also community outreach. It really has become a passion, or it has always been a passion, to be part of the community, to train our students to be part of the community and connect to the community. And we function as really a nonprofit community mental health center. We're connected with Mason. They do give us space, which is wonderful. We're off campus because, again, we need to be in the community, and anyone who's been to George Mason's campus knows that you have to pay a fortune to park there. We couldn't do that if we were trying to reach folks who didn't have insurance, who were undocumented, who didn't have other access to appropriate mental or behavioral health services. I also actually want to comment on the peer piece. While we don't do direct peer stuff, we do take a systems approach, and we absolutely know and we train that, again, it's not just about the person sitting in front of me. You have to connect with their system. And their system could be, for our kids, the parents. Can I tell you, one of my big soapboxes is anyone who does play therapy where they talk to the parents once a month. I can get any person to do whatever I want in my office for 45 minutes. I really can, right? But that's useless if I'm not helping parents understand and feel empowered to take care of their children, right? We sometimes have clergy come in because maybe they're the most influential person in the client's life. And the client agrees that their clergy can understand ways, what's going on, and what are some other evidence-based ways to support them. So again, we do take a systems approach. I do want to highlight really quickly that we have some services, and so your little green cards that we passed out, we have 2 emotional support lines that we run, 12 hours a day, 7 days a week, one in English and one in Spanish. They are staffed by advanced, highly trained undergrads. Again, workforce pipeline. And they are supervised very closely by graduate students, doctoral students, and a licensed supervisor. The only time we close is over the Mason 2 weeks when the entire university is closed, because what we found is we were burning out our grad students covering the lines. So we do close at that point. That is kind of step 1 of what we call our STEP mental health care program. Step 2 is a 3-session virtual coping skills. And we call it intentionally, we're all talking about how words matter. These are coping skills sessions, okay? Anyone in the state of Virginia can get these services. We have counties that do pay for them. So we have grants, I was telling some folks from Prince William County. So any Prince William County resident gets these 3 sessions for free. My goal is ultimately, and about 30% of my job these days is fundraising and writing grants, so just letting you know that, that my goal is anyone, I would like to get enough funding that anyone in the state of Virginia can get these 3 sessions. There's no wait list, okay? No wait list, because we know when people actually reach out, they need it right then. Because there are 3 sessions only, we're able to do that. Our data has consistently shown that 60% of the folks who have 1 to 3 sessions, their choice, do not request further therapy. And so again, what that does is it gets people what they need when they need it, and the people who need more get funneled in to some treatment. Okay. And then last highlight of this is we can do these sessions in Spanish or English. Okay, so we have both. Another thing that I do want to just highlight really quickly, and I know I've got to move on, is we have 2 new programs that are starting up this fall that somehow we got ourselves involved in this summer. How many of you have heard of the statewide Youth Mental Health Corps? A couple of people. So the state of Virginia is participating. This is a national initiative to develop a youth mental health corps of folks ages 18 to 25, up to 29 if they're in the pure substance recovery. And our center actually will be sponsoring 20 of those slots. Yes, we got a little crazy. 8 of which are AmeriCorps folks. So again, supporting students to learn, but also to give back to the community. And one of the biggest initiatives as part of our Youth Mental Health Corps is we've partnered with Sources of Strength, which is a national school-based suicide prevention program. All 20 of those folks will be trained. Another nonprofit we partner with, Connor Strong Foundation, is going to take over the full training, and we have 20 undergrads who will be placed in schools by spring to do these, to work with the schools to develop their own suicide prevention programming. So again, the idea is not that, okay, here's a program that is implemented the same at every school. We train folks with the core pieces that need to be in the programming, but then the peer leaders at the school with their adult supervisor, except I think adults leaders, I think is what they call them. Yeah, I was gonna say Rebecca knows. Do their own programming. So I know Loudon is definitely having people. We have people down at Rappahannock Community College who will be going out. I'm hoping Alexandria will want some of these folks too.
Who are you asking?
We haven't gotten that far. This all started in May, so we're still working. In addition, they're all taking a course we developed at Mason that will give them all the didactics, all the coursework they need to register at the state level for the qualified mental health professional trainee. So it's a really comprehensive program. Yeah.
That's the health and human services.
Yes.
Kate Garber's not here, so just sign that.
I think I apparently will be meeting with Kate at some point. But anyway, so the whole piece is, and then the last piece, and I promise I'll be quiet, is that our other data that we found that we actually did get a HRSA grant this year, which is the most surprising thing whatsoever, to increase the diverse behavioral health workforce in pediatric primary care. And Inova Cares for Children and Inova Cares for Families actually will have some of our fellows. Yeah, I don't know how this got funded, but it did. So that's on the graduate training, social work, clinical psych, and psychiatric nurse practitioners. So that's going to be our fellowship cohort. All of our data that we pulled for our graduates that have worked at the center shows that over 50% go on to work in community settings. So again, that's the other piece that we're really proud of, that we really want to not only train people in community mental health, but also to be out in the community and then giving back in their own careers.
You mentioned veterans.
Oh, yes, I should not forget our veteran work. We have specialized services for veterans. We have special fundraising funds that allows veterans to receive services for free at our center. We have new evidence-based therapy that's being tested right now. If you know of veterans who are struggling with any depression, anxiety, or trauma, a lot of veterans, we have a really cool evidence-based protocol that is being offered for free. We train our students to work with veterans. We also work with law firms to do the independent medical evals for veterans who have had incorrect discharges or not adequate benefits. And we work with many community veteran partners. And we just got word, this will be going out to many of you, is at our gala in the spring, we had the widow of a veteran who committed suicide, and the military decided that that was not related to mental health, related to military service. So we did kind of an interesting, and this is the second time we've done this, kind of a posthumous eval, clearly from the veterans' medical records, military records, as well as the wife's report, we're able to very clearly link PTSD to the military service, which was then very clearly linked to this veteran's suicide. We just got notice last month that she was awarded full benefit. Full recognition for his service. So those are some of the stories that keep us going.
I want to ask an Air Force veteran to say thank you first.
Yeah, and I will, I don't even want to talk about work now, for my role at Amazon Health Services. First of all, that was very rewarding and humbling to hear. 21 years United States Air Force, you heard Colonel talk about strong advocate for veterans and their well-being. I can't speak to what Amazon Health Services is doing about that more elaborately now. I'm only 11 months into the role. I do know that they have resources for their employees that are veterans, but that's some more research that I'm doing. In terms of Amazon, what is Amazon doing in regards to, I'll say, well-being, and also Amazon Health Services is a primary care based. If you know a little bit about it, Amazon bought One Medical then became Amazon Health Services. So what you see now is One Medical around, and eventually probably the next 5 to 6 years, you'll just see Amazon Health Services. Primary care based care, with strong emphasis back to the origin of care begins with primary care, right? As I think about Christian and his stories, it reminded me that I've heard your story before. Amazon is focused on well-being for every single patient that is seen in any of our clinics. In terms of this region, there is one at Tyson, Reston, Nova, and soon to be National Landmark. The corporate structure in that is Amazon Health Services or One Medical, partners with Enterprise Corporation, and of course has their own entity when it comes to primary care. Overall arching vision and goal is to embed primary care in every city in the world, and their purpose is to provide convenience to care, coordination of care, and connection with every single patient and team member that provides care. I am most impressed, I would say, in the fact that, well, let me take a step back. My previous role was Stanford Medicine. I said that earlier, but I spent 13 years at Kaiser Permanente, and specifically 6.5, almost 7 years in this area. Most large healthcare entities, Michelle, Mike can back me up on this, are struggling with access to primary care for multiple reasons. The complete depletion of primary care physicians going into practice, and the ability to embed access into your care continuum is a struggle. I'm impressed with Amazon Health Services because their sole mission is to expand and grow primary care all across the world, so that those 3 C's that I mentioned earlier is at the fingertips and footsteps of every patient that needs it. The only additional thing I'll say about that is Amazon is investing, I don't know the exact figure, but millions of dollars into this initiative to drive clinical students into primary care. And by doing so, part of their mission is to say, not only can you have a job, because they'll have their choice of where they want to work, not only can you have a job at Amazon Health Services, but you will have a stake and stocks in Amazon Health Services. So that seems to be getting interest.
Is there an immediate impact in Alexandria from Amazon?
The immediate impact is, I actually am the Northeast GM, so I cover New York, Connecticut, Boston, New Hampshire. But the GM I spoke to yesterday about this area, the plan over the next 7 years is to embed 47 primary care clinics throughout this entire region.
Is that in concert with what's going on? Is it isolated? What's the coordinated plan to do that?
Amazon has its own mission about expansion. So it's not predicated, I think, on any of the world changes when it comes to that.
What I'm getting at is, I'm looking at what we're doing now, you know, is doing their thing. All the other caregivers are building stuff, taking up land. Is there someplace on this space where we're looking at in the year 2035, this is where our medical landscape looks?
Well, I think one of the unique things about Amazon Health Services is we partner, we have enterprise partnerships. So I don't think there's a competition in terms of that.
If you were to have a conversation with Nova, how does that work?
Yeah, I'd be well.
Not you.
No, understood, and it would be me, unfortunately. Unfortunately, that is part of the marketing strategies to go out to the large healthcare facilities to say, and most of them know. They've heard of One Medical. There probably isn't any large-scale organization here at One Medical or Amazon has not at least had an initial conversation.
I don't want to cut you off, but for the picture we took today, marathon. For the picture we took today, everybody's in that picture. You can write your own story about why we're here. The press release says Amazon rep meets at St. Joseph to discuss mental health access.
Do not print that.